it's important for people to understand that what we're in the process of with Health Canada moving to put us in a situation where we're going to lose access to most of our natural health products. So the end goal is to put us into a situation where if you have a moderate or serious health condition, that you have no choice but to go to your medical doctor, because we're going to lose our healthcare practitioners if they don't have the products that they need to make any meaningful difference for us. Probably half my law practice in my career has been dealing with Health Canada. So, and for that entire time, their goal has been to regulate natural products like chemical drugs so that they can basically get them off the market and get us into this European model. We took this position years ago, which is a real problem for us as far as having sovereignty over our own bodies, where legally everything therapeutic is illegal. So anything for a therapeutic purpose is illegal in Canada. That's the starting position. The government, being directed by the chemical companies, have chosen to deem everything illegal, and then you have to get permission to get market access. But the government of Canada takes the position that, even if we're desperate and we have no option, that they want to prevent us from trying, anything as consenting adults. Like, who owns your body? We didn't have regulations at all until 2004, and it took us a good decade to get mostly legal. So, even around 2014, 2015, you walked into a health food store, like half the store was unregulated. But the funny thing, just using True Hope as an example now, that product is so effective and so revolutionary that I think there's 35 peer-reviewed published studies on it, and in blue chip journals like Journal of Psychiatry, Journal of Child and Adolescent Psychopharmacology, like the big journals in mental health. And all of that research has been funded by government. But it's illegal for True Hope to share any of that published peer-reviewed research. We have the right to freedom of expression in our Charter of Rights and Freedoms. So Section 2, we've got the right of freedom of expression. Health Canada has taken the position some time ago that it is illegal to share truthful health information because, as I say, the starting point of our law is everything is illegal for therapeutic person or purpose unless you get Health Canada's permission. So Health Canada, even though it's not part of the Food and Drug Act and it's not in the regulations, takes the position that, well, we will grant you a license for a specific claim. So let's use eMpower Plus as example. It's licensed and you can find it in health food stores, but the label claim that it's licensed for is something like supports mental health and well-being. Like, I mean, what does that mean? Let's say I had a kid that was in this cohort of rapid cycling bipolar where I can't expect my child to be alive in 5 years. And I've picked up that product on the shelf and it says support mental health and well-being. I will have no idea that that could be the product that saves my child's life. One of the things they're doing is they're imposing what's called cost recovery on the natural health product industry. So, if you manufacture, you're going to have to pay, like $35,000 a year type thing for the right to manufacture. If you also package, another fee. If you label, another fee. If you, warehouse so that you can distribute, another fee. And to apply for a product, yet another fee. And why they're doing this is this self-care framework that they're imposing, the end goal is to have the exact same regulatory requirements that we have for chemical over-the-counter drugs as we have for natural health products. But here's where it gets a little nefarious. As Health Canada is saying, and you can go right on their website and read their self-care product documents, they're saying we're going to use these funds to create a new enforcement arm. And the new enforcement arm is going to do two things. It's going to make sure that these much more restrictive regulations are complied with by the natural health community, and it's going to actively be out in the marketplace looking to see what claims are being made so that we can come down and censor these truthful health claims. So right now, if you are a natural health product, you're in that business, whether you're manufacturing or let's say you're a naturopathic doctor, well, they tend to have them in their offices and they sell what they they're going to say you need to be taking, right? So they're in that business. If they were crossing the line in Health Canada's eyes, the maximum fine they would face would be $5,000. The fines were just increased from $5,000 per offense. And an offense, let's say you're advertising for a month, that could be one offense, from July 1st to July 30th, you advertise. And maximum $5,000. Now it is $5 million per day. And I've had files where if you listen to Health Canada, people would die. And in fact, I had one court case with eMpower Plus where they were charged for selling without a license. And the court said, you're guilty. You're guilty, Trope. You're selling without a license, but I can't convict you. It was legally necessary for you to do that, or more people would have died. So my point is in this is life and death. Like, there are a number of Canadians that are only alive today because they rely on natural health products. Yeah, our Food and Drug Act our drug regulations are not there to protect health. So I challenge anyone to read the Food and Drug Act and the drug regulations and show me where Health Canada is charged with protecting health, with having good health outcomes, or even acting in the public interest. It's not there. They do their public messaging, so we believe this is why they're there. But our drug regulations are there to protect intellectual property rights. But what we need to do is ask, well, okay, you're telling me I'm in danger and I need your protection. So in this case, they're telling us natural health products are so risky that we need these, really harsh penalties I've spoken about, and we need this drug style regulation to protect us. You have to ask, well, okay, you're telling me I'm at risk. Can you compare that risk with other risks that I face in my life? You are 14 times more likely to be struck by lightning than to be killed by a natural health product. You are more likely as a Canadian to be bitten by a shark than to be harmed by a natural health product. And the lightning example is wonderful, because if I was to ask your listener, take out a pad of paper and a pen and seriously consider which freedoms that you would be willing to give up to be protected from lightning strikes. You are so much more at risk of being struck by lightning than killed by a natural health product. We shouldn't even use that as an example because it's unfair to natural health products. The risk is removing these products. The risk is restricting these products. Right now, we can use traditional use evidence to get a license claim. And I use scurvy as an example. Part of this self-care framework, where we get harmonized with the chemical drugs, is we will lose the right to use traditional use evidence to support efficacy claims. Significant number of natural health products are based on traditional use evidence. If you're a natural health practitioner or you rely on a natural health practitioner, this is a 5-alarm fire red alert emergency that if we don't do something, I mean, we're in for a world of hurt. In my lifetime, the 2 largest consumer rebellions have been over access to natural health products. So I was telling you about the one in 98. In 2008, Health Canada tried to get these significant fines and penalties and powers that I was speaking about imposed on the natural health industry. It was then called Bill C-51. And that was probably the largest citizen rebellion in my lifetime. We've just experienced in the last 3 years the largest intrusion of government in our lives, where literally we understand that power has been transferred from us to the government. Like, we found ourselves cowering in our homes and being afraid of the government. There has been a transfer of power from the citizen to the government, and we all know it. Canada, what we're doing with the self-care framework is harmonizing how we regulate drugs and getting rid of natural treatments in line with other countries doing the same thing, so that we're all centralized under the World Health Organization. Is Parliament working for us, or are they not? And this is where this is an opportunity, because we know a large percentage of Canadians will rebel over access to natural health products. So the Natural Health Product Protection Association, which is a nonprofit that I work with, we're starting the rebellion, and we want to equip all the other groups to, take action on their own, make it their own issue, but let's coordinate and let's shut down the MP's offices. The whole government and Health Canada and Minister of Health knows Canadians didn't want these powers imposed on the natural health community because their biggest institutional memory of a citizen rebellion was over this very issue. And those, I can't say the word that came to mind, those, our friendly neighborhood Health Canada and Minister of Health, knowing this, knowing that they couldn't introduce a bill to amend the Food and Drug Act to impose this, so a health bill that would then go to the Standing Committee of Health and we'd all have time to interact then there and go, are you kidding? No, they put it in the budget bill. Like literally, and the budget bill is like 10 miles long because it covers everything under the sun. It was sections 500 to 504. Like, I bet you not a single MP even knew it was in there. So the biggest thing that Canadian citizens have rebelled about in my lifetime saying, don't do this, they snuck into the budget bill. If we can't get Parliament to stop this self-care framework, and we have to get Parliament to deregulate natural health products and get them out of Health Canada's hand, full stop. This idea that they're all illegal is just absolutely offensive to any free-thinking person that's thought the issue through. So this is a godsend for Canadians because this is the fact pattern. We can get Canadians excited about this, and if we can get the freedom groups excited about this, we now have the largest movement in Canadian history because the freedom groups didn't exist before. They're focused on other issues. If we can't get Parliament back on this issue, then it will be absolutely clear that that's a failed model for us. This is the test case. Go to, NHPPA.org and subscribe to our newsletter. Now, we don't send out newsletters actually, but when we have an action or we need, some help with something, then we send out an email. So you have to plug in, and then you have to be checking our site for the like we have a campaign page. Well, what are we asking you to do? When you have an industry like the natural health product industry, and you're going to impose ever stricter regulations that will drive the small and medium players out of business, and then you end up with, a small number of large players left standing. That happens so often that economists have a name for it. It's called rent seeking. But you can only get rid of the small and medium players if you have a trade association called the facilitator that all along tells everyone, oh, it's okay, because this is all done incrementally. The frog is boiled slowly. And that's been the Canadian Health Food Association, has been all along. So here at the NHPPA, we've been saying, look, here's the end goal. And at every little incremental step, we've been saying, stop, we need to stop this now. We need to get involved now. I mean, latest example being the self-care framework. It came out in 2017, and we tried to get the industry excited, but we couldn't because the Canadian Health Food Association, being the facilitator, and they take a lot of money from government, by the way, and their real interest is being able to have a seat at the table with government. Right. And they say that publicly, and they've said it to me. So, I tried to get them involved in resisting this in 2017. So they've been the problem. Another thing that we need to do is basically organize, and I need to track down because I know there was a freedom group that was putting this infrastructure in place, and if their name comes to mind, let me know. We need to organize in all of the 338 ridings where we have groups formed in each party's constituency joining the party and making it clear we're not, when it comes up time for nomination for the next election, we're only voting for candidates that are supporting this issue.